A vasovagal attack during ear cleaning occurs due to overstimulation of the vagus nerve, typically triggered by irritation of the external auditory canal. This can cause symptoms like dizziness, nausea, fainting, or even a temporary loss of consciousness. Here's how to manage it. First, stop the procedure. Cease any further stimulation or cleaning of the ear. Next, position the patient by laying them flat on their back with legs elevated to improve blood flow to the brain. It's important to monitor vital signs, observing heart rate, blood pressure, and oxygen saturation. For supportive care, reassure the patient to alleviate anxiety, as stress may exacerbate symptoms. If the patient is conscious and not nauseated, offer water for hydration. Most vasovagal episodes resolve spontaneously within a few minutes, so allow the patient to rest before sitting or standing up. Avoid further ear cleaning for the day to prevent recurrence. In severe cases, if the patient experiences prolonged symptoms or significant bradycardia, administer atropine under medical supervision to counteract vagal overactivity. In rare cases, consider transport to an emergency facility for advanced monitoring and care. Death directly linked to ear wax removal is extremely rare and typically occurs in unusual circumstances, such as complications of vasovagal syncope, severe bradycardia, or cardiac arrest following a vasovagal response, though this is exceedingly uncommon. There can also be trauma or infection from accidental perforation of the ear canal or eardrum, which might escalate in immunocompromised individuals. Additionally, underlying conditions, such as pre-existing cardiac or neurological issues, may be exacerbated during or after ear cleaning. There is no significant documentation of fatal outcomes solely from earwax removal in standard medical practice. However, improper techniques or the use of unsterile instruments by untrained individuals may increase the risks of complications. To prevent issues during ear cleaning, avoid inserting objects like cotton swabs deep into the ear canal. Opt for softening agents or irrigation under professional supervision. And always consult a healthcare provider for persistent wax buildup.